Welcome to the HealthThatCares YouTube channel. In this video, we will cover type 2 diabetes, formerly known as adult onset diabetes or non-insulin dependent diabetes. We will discuss the prevalence, the signs and symptoms, the screening and diagnosis, the pathophysiology, and the complications of the disease. Type 2 diabetes affects approximately 460 million individuals worldwide, while affecting approximately 25 million individuals in the United States alone. These numbers are so large they're difficult to fathom. To put this into perspective, one of the largest venues in the world is the Indianapolis Motor Speedway. At capacity, it holds approximately 250,000 people. The population in the United States affected by type 2 diabetes would fill 100 Indianapolis Motor Speedways, while the world's population affected by type 2 diabetes would fill almost 2,000. This disease not only affects millions of people, but is also very expensive to the U.S. healthcare system. It is estimated that 14% of U.S. healthcare expenditures, or $314.7 billion, are related to diabetic care or the complications of the disease. Now we know about the prevalence and cost to treat the disease, but what is it? Type 2 diabetes is a common metabolic disorder, or problem where your body's cells cannot adequately take in blood sugar and store it or convert it to ATP or energy. The body's inability to process sugar from the blood efficiently results in our first sign, hyperglycemia, or elevated blood sugar. This sign, however, does not cause distress unless it is extremely elevated. A normal range for blood sugar is 80 to 110 milligrams per deciliter. However, an average person could walk around with a blood sugar of 350 milligrams per deciliter without any idea that their sugar was high. This is quite typical, as a majority of people with type 2 diabetes have no symptoms. Actually, the American Diabetes Association estimates that between 25 and 40% of individuals with type 2 diabetes do not even know that they have it. So what are some common symptoms or signs that are recognizable? Classically, when blood sugar gets too high, one will experience frequent dilute urination, polydipsia, which is intractable thirst, blurry vision, and rarely a hyperosmolar hyperglycemic state, HHS, or diabetic ketoacidosis, DKA. These last two rarely occur, but are possibly life-threatening complications of type 2 diabetes. We will touch on these two conditions in a separate video. A diagnosis of type 2 diabetes is made when a person presents with these recognizable symptoms, along with a random blood sugar level above 200. There are, however, 3 other ways to make the diagnosis, and only one of the 4 criteria need to be met for a diagnosis of type 2 diabetes. The next criteria is a fasting blood sugar level of greater than 126. For this test to be accurate, the fasting must be for at least 8 hours before the blood test. The third criteria is the 2-hour oral glucose challenge. In this test, a person is given 75 grams of oral glucose, or about as much sugar as a 24 ounce of Sprite. After 2 hours, the blood sugar is checked, and if it is higher than 200, a diagnosis of type 2 diabetes is made. Hemoglobin A1C, or glycosylated hemoglobin, is a test that looks at blood sugar control over the past 90 days, or the life of a red blood cell and its hemoglobin. When the blood sugar is elevated consistently, as in type 2 diabetes, the red blood cells and hemoglobin are surrounded by more sugar than normal all of the time. This leads to a structural change in the hemoglobin that doctors can measure with the hemoglobin A1C blood test. If 6.5% or more of the circulating hemoglobin in the blood has been structurally changed by the high blood sugar, then a diagnosis of diabetes type 2 can be made. And just as a reminder, only one of the 4 of these criteria is needed for the diagnosis of type 2 diabetes. So now we know that type 2 diabetes is an inability of the body to properly process sugar, so the sugar sticks around in the blood, causing high blood sugar levels. But why does this happen? Like on a cellular level, why is a diabetic's fasting blood sugar higher than a non-diabetic's? Type 2 diabetes has 3 main characteristics. Number 1, high blood sugar or hyperglycemia. Number 2, insulin resistance. And number 3, impaired insulin secretion. So this brings up the question, what is insulin? Insulin is a hormone produced by the pancreas in response to elevated blood sugar. So for example, if we were to eat 5 Oreos, the cookies would be digested in the stomach and small intestine, and then broken down into simple sugars. One of the most simple sugars is glucose. This glucose is then absorbed through the small intestine and into the blood, thus elevating the blood sugar. The pancreas senses the elevated blood sugar and in response secretes insulin into the blood. The insulin then circulates throughout the body and lets the cells know, hey, we have a lot of sugar in the blood, you should take it and use it for energy now or store it for later. After this message from insulin, a non-diabetic cells listen and say, okay, I love to use sugar, and take in as much as they can. This moves sugar from the blood into the body's cells. When the body's millions of cells work together, they are able to move the sugar quickly and effectively out of the blood. When the sugar is back to normal, the pancreas stops making insulin. So the cells stop getting the message and ultimately stop taking sugar from the blood so quickly. This concept is a difficult one to fully comprehend. The easiest way is to picture two compartments that we will represent with two cups. One cup represents the body's blood compartment, and the other cup represents the body's cells. Now, insulin does not make sugar disappear. Rather, it encourages the transfer of sugar from the body's blood into the body's cells, decreasing the amount of sugar in the body's blood and increasing the amount of sugar in the body's cells, where it can be used most efficiently. So, what's different when a type 2 diabetic eats 5 Oreos? Well, the cookies are processed in the same way, in the stomach and small intestine, then broken down into simple sugars. But the difference arises when the sugar gets absorbed into the blood. In type 2 diabetes, when the blood sugar rises, the pancreas can't make as much insulin, so there's a relative insulin deficiency. This deficiency results in a weaker message to the body's cells, like, hey, we have some sugar in the blood. If you want it, you can take it. And on top of that, the body's cells don't even like listening to insulin, so they don't bother to take up more sugar. This is called peripheral resistance to insulin. To review, in type 2 diabetics, when the blood sugar goes up, there is less insulin released from the pancreas, resulting in a relative insulin deficiency. In addition to the cells not taking orders from insulin or peripheral insulin resistance. These in combination are why diabetics' blood sugar is much higher. We now understand how to diagnose type 2 diabetes and why the blood sugar is high. The final question is, why does it matter? Why should I try to keep good control of my blood sugar? I would like you to think back to the hemoglobin A1C blood test. If you remember, the consistently elevated blood sugar causes structural changes to the hemoglobin inside the red blood cell. These changes can then be measured by a blood test to tell us how high the blood sugar has been over the 90-day life of the red blood cell. It turns out that hemoglobin is not the only part of the body damaged by consistently elevated blood sugar. There can also be major damage to small blood vessels or capillaries, as well as larger blood vessels or arterioles. Damage to the capillaries is called microvascular disease. It is bad to damage these small vessels because every organ in our body has capillaries inside them. The organs rely on the capillaries for nutrients and oxygen, both of which are necessary for the organs to function correctly. The commonly affected organs by microvascular disease are the kidney, which can progress to kidney failure, the retina in the back of the eye, which can progress to blindness, and the nerves for touch, especially in the feet, which can progress to numbness in the extremities. Damage to the larger vessels, or arterioles, is associated with coronary artery disease, where the blood vessels on the heart are damaged. This can lead to decreased nutrients and oxygen getting to the heart, and can eventually result in a heart attack. The final major complication of damage to the larger vessels is peripheral artery disease. In this condition, the arterioles of the arms and legs are damaged, resulting in decreased blood flow to the skin, muscles, and bones. This decreased blood flow, in addition to the loss of feeling, especially in the feet, can result in terrible sores, injuries, and infection, eventually leading to amputation of the affected limb. The best way to avoid these complications is to keep tight control of blood sugar and to have frequent office visits with your doctor. A reasonable goal for hemoglobin A1C is around 7%. However, keeping it under 8% is enough for certain patients. Take the medications that your doctor prescribes, eat a healthy diet, and most importantly, get out there and exercise. This video is meant to be informative and not meant to replace the recommendations of your doctor. Always follow your doctor's advice. I hope you learned a lot, and thanks for watching.